Religious Beliefs and How They Change Nursing Care by Kylie Ross and Jana Warren. Today we are going to discuss the importance of nurses being able to evaluate a patient's spiritual needs, the importance of maintaining adequate care while honoring a patient's religious values, the importance of knowing some information about different religions, and how spirituality beliefs of patients has been discovered to help with the coping of sickness and death of patients. Providing quality patient care is the top priority of a nurse's role in a healthcare facility. Among taking action and providing adequate, compassionate care for a patient, nurses must also evaluate a patient's spiritual needs. Meeting patients' spirituality needs begins with serving the patient and providing compassionate care. Delivery of spirituality care includes continuity of care, active listening, and effective communication. Nurses must be fully present and attentive to their patients. It is important to be supportive to them in areas of physical suffering, emotional suffering, and spiritual suffering. Today we are going to focus on providing patients' needs while suffering spiritually and how it can in return affect the patient's emotional and physical suffering. With complete understanding of patients' individual spirituality, precise ways of care can be addressed to benefit the patient. It is important that we know the patient's religious values to provide adequate care. A patient's religious values could affect the type of care needed to be provided. If the patient finds a certain practice offensive due to their religion, then the nurse needs to be understanding and support the patient in that situation, but still provide adequate care to the patient. Patients may find certain hospital regulations as condoning on their beliefs. For an example, it may be against the patient's beliefs to wear a hospital gown. It is important for the nurse to be understanding and accept the patient's belief without being condemning or judgmental. A nurse can make this outcome be beneficial to both the patient and the caregivers by encouraging the patient to wear their own clothing. Also, by assisting the patient to dress in their own clothing, the nurse can help maintain the patient's well-being. Valuing a patient's inner strengths and motivations will give reference to the level of care that is essential. By practicing professionalism in nursing, we must learn and deal with one's own views as well without being overwhelmed or threatened. It is important to know the degree of spirituality awareness usually varies among individuals. Nurses must understand and acknowledge their patients' views on spiritual beliefs before encouraging it. In rare cases, a patient may be against the encouragement of spirituality, and the nurse must remember that care must still be respectfully completed regardless of the nurse's opinion. By forcing one's views on the client can increase spiritual distress in the patients whose beliefs are not congruent with yours. This could also cause more physical and emotional distress on the patient, which could cause the patient to not heal in a timely manner. Nurses knowing the practical points for each religion is a lot to consume. However, just having a general idea can lead to applying the appropriate care for the individual. Each religion holds different beliefs and traditions. Today I'm going to talk about a few different religions that affect the care that the healthcare providers need to provide. Things to remember when caring for Buddhist patients. Nurses must keep in mind that the patient requires time to meditate, in which they need a place that is quiet and peaceful with no disturbance. They also have a high regard for concerns with modesty. So using general hospital gowns could be an issue. Some Buddhists are strictly vegetarians and do not consume any medications that are produced by using animals. When caring for Buddhist clients, nurses must be aware that many do not accept certain types of medications, like pain medicine and that sort, and that they worry it will dull cloudy awareness. Nurses must fully discuss the medications that are prescribed to both the patient and family members before administering the drugs. When caring for Hindu patients are quite similar to Buddhists in these ways: modesty, being strictly vegetarian, and not consuming any medication that are formed by products of animals. One common practice that is noted to Hindus is fasting. With the means of fasting, nurses must discuss the implications in the light of the dietary or medical care plan. Hindu patients may also wear jewelry or adornments to strengthen their strong religious meaning. Nursing staff should not remove any of the adornments without first discussing it with the patient or their family members. Hindus have culturally based concerns regarding the treatment and care by an individual whom is of the different sex. Nurses should not discuss an issue with the genital or urinary in front of their spouses, out of respect for the patient's religion. When caring for Hindu patients, we have to remind ourselves that they hold modesty to a high degree. Traditions of Hindu hold expertise of medical practitioners in high regard. It's common for Hindu to wear a yarmulke or kapachi, especially for prayer. Some patients may wish to wear them at all times. Patients whom are of the Jewish religion hold a highly significant regard to the Jewish holidays listed below. During these holidays, medical treatment and procedures all have to be rescheduled. All Jewish holidays run sundown to sundown, so we should remember this when rescheduling the patient's appointments or procedures. When caring for Jewish patients, it is important that we remember that these patients may also request for a special type of diet known as a kosher diet, in which prohibits certain foods such as pork and gelatin and combinations like beef and dairy products from being provided to them. This is just a few of the many religions that has affected the care provided to patients. As a nurse, remember that all of these different types of religions should be reviewed to provide adequate care to all types of people. Among the many challenges that a nurse faces on a daily basis of a shift, the greatest one may be dealing with a patient whom is of a different religious belief. Nurses must play a key role in respecting the religious diversity among both the patient and family members. As a nurse, you must remind yourself that one must act in ways that are justified in the best interests of the patient and their religious beliefs.